Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor. And today on our podcast, we have a very, very special guest, Frankie Shinn. Hi, Frankie. How are you?
Hi, Dr. Lexi. I'm good.
So full disclosure, Frankie is a very, 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 very dear friend of mine. And she is an attorney by trade, correct? And currently working at a university setting, right?
Yes.
Okay, wonderful. You have 2 children.
I do.
And who delivered your second child?
You caught her one-handed.
I did. I took your older daughter for ice cream, and then we came back up, and I was actually working at the hospital at the time. So I was on shift. So it wasn't like I just swooped in and delivered your baby.
No, but it was pretty close. It was the Lexi, there's something wrong. And then I think you peeked and you were like, that's a head. Mm-hmm. And then I had a baby. And I remember you caught her one-handed.
You screamed a little bit too. There was some wailing and
it was a short scream because it was really only not even a push. It was kind of like a sneeze into a baby.
She was ready to enter the world.
Very quick entry.
Mm-hmm. So as you know, I've been trying to do this podcast to kind of educate people on all things pregnancy related.
Yes.
And you've had 2 babies, obviously, one of which I was there to catch. And I always start this podcast with some questions that everybody gets. And you don't know what the questions are.
I don't know what the questions are.
No. So I'll try to go through them quickly because we have so much that we can talk about today.
Okay.
So there's 10 questions. And then after that, there's 10 true false. So we'll go really quickly.
Okay.
All right. Question number 1. What does the abbreviation OBGYN stand for?
Obstetrics and gynecology.
Yes. So good. Do you think most lawyers or attorneys know that term?
Probably not unless they're in like med mal or insurance defense. I think sometimes if you're not a woman, OB-GYN goes right over your head. But I think most women of a childbearing age probably have familiarity with those letters.
Got it. Question number 2. What do the letters MFM stand for?
Maternal-Fetal Medicine.
Yes. And since we are very dear friends, if you did not get that right, I was going to be very sad.
I had to think about that. It's been a long day already.
I know. Although it's kind of not fair because there are many times where I'm like, what do you do again, Frankie? But you have had various different roles. So even though you're a lawyer or attorney.
I'm a licensed attorney currently, but I work in administration. So there's nothing super lawyerly about my job other than now I argue with students instead of lawyers.
Okay. Well, my sister and her husband, they're both attorneys. And I'm doing air quotes. I mean, I do this a lot. They're attorneys. But they're not really like what I say people watching TV think of as attorneys, right? Like they're not that classical.
And as a sidebar, that's what a lot of, I think, law students and people looking into law school get wrong is that you have to become an attorney, like the TV kind of attorney when you get licensed.
Mm-hmm.
You don't even have to get licensed, first of all. Second of all, there's so many jobs you can get as an unlicensed or licensed attorney. I've held several of them. I have been in-house counsel. I have been a prosecutor. I do administration now. You can become a professor. There's so many routes. You can become a consultant. There's so many things you can do with a JD that a lot of people don't understand.
This is why I do this too, so I can learn. Question number 3. How does a provider come up with your due date during pregnancy?
Based on your LMP, your last menstrual period.
So good. So good. Question number 4. When is a pregnancy considered term?
At 36 weeks to 40 weeks.
So
I
close.
believe is that 38?
37.
Oh, is it 37?
37.
Gosh,
37 and beyond.
36. Okay.
It's okay. You were within a week.
I was close. I always feel like we have it's been so long since I've been in the medical setting. I always feel like we always have like the safety dates, right? Mm-hmm. So like 20 weeks, like 24 weeks, 30 weeks. I always have like those cutoffs. So in my mind, I'm like 36 are going to be fine.
Well, and it's an even number, right? Yeah. Like it makes sense in most of our brains to count it.
In my mind, if they have a baby at 36, I'm not freaking out about like getting the NICU involved and getting steroids on board and like, thinking about those things. When I hear 36 weeks, I'm like, you're good.
Yes.
We can have a baby. Your baby will be okay.
Life will be okay.
Yeah.
And tangentially, let's go into this if you're okay sharing. How did we meet?
We worked together at Good Sam during your residency. You were a first-year resident doing your OB-GYN rotation, and I worked in the hospital as a health unit coordinator and patient care assistant, which is basically a glorified nursing assistant.
Health unit coordinator. I knew your title to me, I remember, was a HUC.
HUC.
And I didn't know what HUC
We used to be a
stood for.
HUS,
Oh.
but then they called us Hussies.
Oh.
Health unit secretary.
Okay.
I think the term secretary is now outdated.
Okay.
I don't think we use that anymore.
Okay.
So, I think they played around with maybe health unit administrator, health unit
Something.
coordinator is what we settled on. So it was
There you go.
HUC.
Huh. Okay.
HUC and PCAs.
Okay.
Yeah.
There we go. So that's how we met. We both worked in a hospital when we were training. And as an intern, if anyone's watching that is finishing medical school and starting internship, you start in July. So the scariest time to be in a hospital for anyone who goes to a hospital is basically the beginning of July, because that's when all the new interns are starting. But I would say that you probably knew as much as I did about delivering babies whenever I started my intern year. I mean, it's just fascinating, the stuff that you taught me and that everyone learned from each other in there, because it was such
It's
a busy
very
hospital.
communal. It's very like, if you're not a team player, L&D is not for you.
Yep. L&D is for labor and delivery.
It is such a team sport.
Yes.
It's not even funny.
Yes, it is.
And one of the greatest things I always tell the new residents coming on is, please listen to your nurses. Please listen to your nurses. They have been around so long.
Yes.
They know so much. And like, that's who I learned all of my stuff from.
Yeah.
And I'll tell you, like, July is scary for you guys, but and maybe for the patients, but we love July. We love when the new residents get there. It's like our favorite time. It's like Christmas. Like I said, we're like
fun new people.
Yes, fun new
visit
people.
with.
So yeah, no, it's always a glorious time around in July.
So yeah, if you hear that on TV shows, or you have a friend in the medical field and they're like, oh, July, that's where that comes from. All right, question number 5. What is a normal fetal heart rate?
Oh man.
Very good. 110 to 160.
Okay, I was like, it's somewhere in there.
Yeah.
It's
higher
high.
than ours,
It's like a hummingbird.
Yep. Question number 6. What is antenatal testing or fetal well-being testing?
Is that like the FSTs?
The NSTs.
NSTs. Okay.
Yes.
So I'm going to stamp all of my letters. Yes, it's when we bring moms in to hook them up to their fetal heart rate monitors and just check on baby's heart rate, and I think we check their fluids and stuff like that. And we just watch them on a monitor for 20 minutes and make sure they're okay. And then we send them on their merry way.
Very good.
So,
and we either do with the strip or I call them a strip because that's what prints out, but the 2 belts that go around the waist. And
I was a pro with the belts.
Or a quick ultrasound. And sometimes it's part of both of them. So yes, very good. Very good. Question number 7. How does an ultrasound estimate the weight of a fetus?
You know, that I actually don't know because I never got ultrasound like certified or anything. Right. I think they
do you remember
measure
back
it
when you were pregnant? Okay,
I think they do like a head to butt measurement
early on before 14 weeks. That is correct.
And then they, I don't know, they measure your baby on the screen and they just tell you numbers and you're like, okay, and they're never right.
There are a lot of numbers and they're not very exact. That is very true.
Layla was supposed to be my second one. She was supposed to be, I think, closer to 8 pounds, if not more. And she popped out at 6 even. And then Adia was supposed to be right on track. And she was like a fat baby. Like she was like a fat 8-pound baby.
Yeah. Ultrasounds they can get up to 20% off. And people, Now here's the thing. So you said first baby was bigger, second baby was smaller. When you were pregnant with the second one, were you like, oh, she feels smaller to me?
I think so. I don't really remember. It was kind of a blur of a pregnancy.
Because a lot of studies show that the best predictive way to know if the baby's going to be bigger or smaller than the last is honestly to ask the patient, because they, I mean, obviously it's their body, but they are.
I think I was so freaked out by the size of Adia that I was so nervous about how big the second one would be that I think I thought she felt bigger actually.
Oh, wow.
And so they induced me on the second one because they were not going to have a repeat of the first one. The first one was a nightmare delivery. She had shoulder dystocia.
Oh, no.
She had a double nuchal.
No.
She was huge. My pelvis was too small. Like everything that you think could go wrong went wrong. in that whole delivery. So when Layla rolled around, we came up with a game plan because I just was not going to go through that again.
Yeah.
I had a 3rd degree tear, girl. So
With the first one.
With the first one.
I was like, not with the
Not with
second
yours.
one.
No,
I'm telling
I
you,
was
that
walking around eating ice cream 30 minutes after I had her. Like we were good.
That one was a good one.
Yeah, that was the easy one. If all my deliveries could have been that easy, I probably would have had way more kids. But that pregnancy was not easy. The delivery was
perfect.
Easy. Two is perfect. And they're perfect. They're perfect.
They're
so
great.
like, why would I want to chance fate?
No,
You know?
I get that. I get that.
No, we're good.
All right then. Question number. The weight thing. They measure, just like you said, they measure head to bum when they're before 14 weeks, and after that they measure like an arm bone, a leg bone, around the head, around the belly, and then they estimate it. That's why it's not that perfect.
Yeah, I think I just tuned out the weights usually because I'm like, you guys are always
I don't
wrong.
want to know. That's true.
You guys
I
are
get
always
that.
wrong.
I totally get that.
Yeah, they told me Layla's going to be huge. So we're like, induction.
Question number 8. What makes up amniotic fluid?
Goo. Lots of clear goo.
Where does it come from?
You know, that's actually a really good question. I don't know where that comes from.
It's the baby's pee.
Wow. I'm learning new stuff. Okay.
It's fascinating, right?
That is fascinating.
Yeah, I know.
Wow. That makes me really think of amniotic, like on the movies when they're like, my water broke. That like really makes me rethink like what just broke.
Yeah.
So they did pee themselves.
I mean,
because I feel like
they didn't pee themselves. But
baby
the baby
peed them.
The baby peed them. That's a new way to say it. My baby peed me.
Yes.
That's interesting. Yeah. Because, Sex in the City, she gets her shoes ruined because the bag of water. Remember the pink fluffy ones? I remember that episode.
Oh my gosh. Yeah. No, I didn't think about that. I didn't think it was all baby pee. I knew it was some baby pee. That's a lot of pee.
Well, and then, when they're moving around and we can see that they swallow. I mean, that's
I was just going to say, and they just breathe in their pee.
Well, and remember, they're practice breathing, but they're not actually breathing because they're in a pool of their own pee.
Oh, that's so gross.
I know, right?
Wow.
It's cool though.
Yeah.
And someone asked me one time at some point, and I don't know how this came up, but I was somewhere and I was like, God, amniotic fluid is so salty. And they said,
because I think we've all been sprayed at some point.
So people that haven't been in a hospital or delivered a baby or worked in labor and delivery, like, how do you know what amniotic fluid tastes like? I'm like, it's very hard to 100% get out of training and practice and avoid amniotic fluid somehow getting in your face or your eyes or your mouth. No matter, masks, goggles, glasses, everything. That stuff just,
Yeah,
sprays.
I worked trauma before labor and delivery, and yes, the fluids go a-flying.
The fluids go a-flying.
I have some pretty disgusting stories about fluids.
Yeah.
None of which are relevant to our conversation today, but
the fluids.
Maybe for a rainy day.
The fluids. All right, question number 9. Who should be offered Down syndrome screening in a pregnancy?
Women over 35. And I believe women with a history in their family of Down. And I know there's another one, but I don't know what it is.
Everyone now.
Is it everyone now?
Everyone.
Really?
Everyone.
When did that start?
Everyone. So back when you had your kiddos,
yes,
the tests were a little bit different.
Okay.
And the tests now are better. Yes. Ooh. And they're better across the board. And, just like anything, whenever there's a new test, they give it to the people that are at the highest risk. Mm-hmm. And then insurance is like, well, maybe we'll cover it for the lower risk ones. And then it's like, well, is it as good in the population that has a lower risk, et cetera, et cetera, et cetera. Regardless, whether you do a test that's 85% good or 99% good, everyone should be offered the test. Wow. Doesn't mean they have to do it. And it doesn't mean that they're at a super, super high risk.
So I remember when I was having my second one, there were some arguments in the medical community about whether the risk was actually greater over 35 versus if that's actually still true. Yeah. And I know a lot of people felt that statistic was not true anymore.
Yeah.
So is that like part of the...
So it's a great question. For Down syndrome specifically, you're still going to have a higher risk of a Down syndrome child if your age is above 35. Okay. And even more if your age is above 40. Now, what we're knowing now is that if you talk about any chromosomal abnormality, because there are a lot of rare ones that we can't test for with these screening blood tests, the rate is approximately the same for anyone, regardless of whether you're 25, 35, 45. It's about 1 in 280. And that's any chromosomal risk, big or small.
Now, I have not worked in the medical field in probably 12 years now, I think was the last time I worked in a hospital, maybe 13 years. And it's nuts how much the information has changed in just a decade.
Yeah.
Like that is news to me. I had no idea they offer it to everyone now, which is, it's wonderful. I think everyone should get it.
Yeah.
There's no harm in planning ahead.
No. And the biggest thing I think that we think about is that if it doesn't run in my family, I'm not at risk. And it's almost like breast cancer, right? Yeah. So yes, I can tell my personal physician, no one in my family thankfully has breast cancer. It doesn't mean my risk goes away. And for Down syndrome, if you have someone who says, I have no one in my family that's been affected by Down syndrome, that's fine. Your risk is still going to be based upon the age that you are. And you need to know that 98-ish% of Down syndrome is caused from random sporadic mutations.
Wow.
Not something that is
not genetics or anything
in the family. Because we use the word genetics, and genetics can be a very vague term.
Hereditary? Is that a better term?
Yeah. So because when people say, oh, it's not in my family, I try to break it down as best I can to say, even if it doesn't run in your family, your risk is still 1 in whatever. I look at a chart based upon their age. And if you're above 35 or 40, your risk could be somewhere of 1 in 35, 1 in 50, maybe something like that. And then we have to break it down further. And if you get that blood test done, you can take your risk to like 1 in 50,000. Yeah.
That's insane.
That's my long explanation for that. Question number 10, which this is kind of, I'm learning as I'm doing this more, not a very fair question. So,
oh boy.
I know.
Oh boy.
What is considered a normal length of a cervix in pregnancy?
I'd like to phone a friend. No.
She used to check. Yeah. So, I mean, like you've heard, that's good. Yeah. That's above 2.5 centimeters.
I know that when we train people, we always use this as your picture of the cervix and then, doing that.
For people that are listening and not watching the visual portion of this podcast, Frankie has a fist in the air and 2 fingers going into the hole that her fist is creating. That was fantastic.
You like that?
That was a very good.
That's how we show it, and then we show people like you are not complete until this happens and I can't stretch my fingers anymore. So
oh my God.
Yeah, it's like testing steaks, right? It's the different parts of your hand.
When you need him?
This is the different parts of your hand to test the tenderness of your steak as it's cooking.
Which one's medium rare?
I don't remember, but I remember this is I think.
Isn't it different if you're? No, we're gonna have to ask him that.
Yeah, we're gonna have to ask, but it's like the same thing. You have to show people the visuals, right? Yeah. So when you show someone this is a closed cervix, it makes sense. You're like, this is in your body.
When you tell people 10 centimeters and they find something that's 10 centimeters in diameter, they're like, there's no way that's
and then you show them
it'll come out.
I'll take this plate. And then this is not 10 centimeters. This plate is not 10 centimeters to me. So
because everyone's fingers are the same length. I
have really long, freakish fingers, and
it's pretty close.
And it's
okay. Now we have to do this because I have pretty long.
I think you and I have.
Oh wow, yeah, that's impressive. I am a 6.5 to 7 glove. So that's for a female hand. That's on the larger side.
I think I'm a 7 to 8. Yeah. So I have very long fingers. So
I always tell people my mom was like,
piano or gynecology.
Or check a cervix. So I was like, I guess I'm going to check a cervix.
Yes. It always used to be play a piano. And then when I got into L&D, I said, you have beautiful fingers. You can check cervixes now. And everyone would be like, what?
And now it's into, okay, this is my question because cervices or cervixes? I think it's cervices, but I don't know.
Cervices.
And now what's the plural of penis?
Peni. I don't know. Is it?
I don't know. I want someone to Google this, please.
Should I Google this? Should I Google?
Yeah, Google this.
Okay, hold on.
We're going to phone a friend.
I think it's penises.
Can I ask you a question for the podcast? I'll delete it later if you want me to. Sure. What's the plural of penis? He just walked in. He's like, what? What? Well, I mean, because a cervix is it, right? And cervix we think is cervices, right? That makes sense for the plural of an X. But what's the plural of penis? I don't know. She's Googling it.
I thought it was peni, but it's actually penises.
Penises.
And cervix is cervices.
Cervices.
Or cervixes.
Oh.
It is both.
Okay,
it's
penises.
Both. Yes.
Penises.
I think peni is cuter.
I kind of like peni.
It's like, here, come look at my peni.
This is the plethora of peni.
A plethora? What is a plethora?
I love that. Oh, shoot. I'm dropping stuff now. I think you have to tell it to plethora of pinatas, right?
Yes, it's a plethora of pinatas.
Plethora of pinatas.
But,
and that is from Three Amigos?
Three Amigos. Mm-hmm.
When they do,
Yeah, the dance. Yeah.
With Steve Martin.
Yes.
Who are the other?
Martin
Steve
Short.
Martin Short. Who's the third?
Oh, Chevy Chase. Yes.
Sorry, Chevy Chase. Like Chevy Chase is watching this. Dear Chevy Chase, I am sorry I forgot you as the third of the Trace Amigos.
But now you know it's a plethora of peni.
Plethora of peni. Oh my God, I love this. Okay. We will get you into the rapid true false questions and we're going to dive in. Okay, true or false? Question number one. A fetus can have hair in the womb.
Yes.
Good. Question number two. True or false? A fetus can hear.
True.
Wonderful. I love how she switched from yes to true because she noticed.
Yes. I said yes, you said true. So now I'm mirroring.
I know. You're so good.
The whole thing.
Question number three. If a pregnant individual eats sugar, this will wake a fetus up if they are sleeping.
I want to say yes. I want to say yes because I feel like when we have sluggish babies in the womb, we always make them do cold water and like eat something, but I don't know if we make them eat sugar.
So there's a good point. Some people, and again, the data is all over the place on this. We know we can try to do fetal acoustic stimulation, which is the vibration, because we already know that they hear after, they can feel the vibrations here, quote unquote, after 25 weeks. Cold water kind of, I think we always kind of thought of it as an old wives' tale, but also like our patients are severely dehydrated
in Arizona. So we're just like, it can't hurt.
No,
so here, have a glass of ice cold water, drink it.
So but sugar, the problem is if you think of people with bad diabetes, right? That have really high sugars all the time. They're at risk of babies being more sluggish, being bigger, not moving around as good, and even fetal death, which we call stillbirth, right? Or you can say it that way, or an intrauterine fetal demise. Some people, when they get steroids to give their baby's lungs a boost, their babies on a monitor will look more, she knows the term that we utilize, flat. They won't be as movable.
Really?
Like they don't move around as good. So that's some of it. But for quickness, if you get if a baby's blood sugar was low, i.e. the mom's sugar was low, so the baby's maybe got a lower sugar now because sugar crosses a placenta and insulin does not. So let's say mom hasn't eaten for 15 hours and her blood sugar is low. If you give her some food and her blood sugar goes up, the baby's blood sugar would go up to a better level and that baby might move more. But if mom is at a normal sugar level and you give her a burst of like a bunch of OJ and like
probably won't
whatever,
do much.
Yeah. Because they go through sleep cycles.
Yeah.
So that's a controversial one. I'm learning as I ask these more and more that I'm like, these are not straight slam dunk, but they're good for conversation.
Yeah,
pieces,
no, absolutely.
You know? So
that was news to me. Yeah. Like I said, I'm like, I just know that when we have sluggish babies, we just make them do stuff.
Yeah. Something.
Yeah,
do something.
Cold water, food.
And water is great because so many people are dehydrated, just like you said.
So many.
Question number 4. Everyone should be screened for diabetes when pregnant.
Yes, absolutely.
Wonderful. If you don't say true instead of yes.
Sorry, true. True is correct.
Question number 5. True or false? Everyone should be screened for thyroid disorder when pregnant.
I would say if your insurance covers it, go for it. But I'm going to go with true. But I don't think I had a thyroid screening when I did mine.
The answer is false. Your doctor did a great job.
Okay.
It is considered false. If you have symptoms, yes, but not a blanket thing. Like diabetes is a blanket statement.
Interesting.
Yeah.
All right. Yeah. Thyroid was not something I got tested for, but I was like, gosh, if your insurance covers it these days, why not get the whole panel?
And a lot of people are getting tested for it, but it's kind of like the thing where if you don't need it and you open up this Pandora's box of stuff, it could start you down a place you don't need to be.
Yeah.
So, all right. Question number 6, true or false? Someone with 2 prior cesareans has to have a 3rd cesarean.
Has to?
See?
Has to. Because I feel like in our line of work, that is true. Like where we worked previously, that was true. But I don't think that's true in the world.
So true or false?
False.
False is correct.
Ah, yay!
We used to, like back in the day, really, if you'd had 2,
you were done.
And that was the data.
Yeah.
And now the data
because we had VBAC.
Different. So now it's different.
Yeah.
So some of the data has changed. But as I've told people on this before too, it's why you had the C-section. It's how long ago was the C-section.
It's also the incision, right?
It on the uterus.
On the uterus, yeah.
Yeah. And sometimes you just see it on the skin, but depending on the uterus, does it go up and down? Does it go side to side?
And then is it true that if you had a teed uterus, that increases your risk of not being able to have a VBAC?
Yeah, because the T, so what she's explaining is when they cut into the uterus, they usually do a very bottom kind of horizontal incision. And then if they have to go vertical and extend that incision, we call it a T. I mean, it's an upside down T, but it's a T. And so then that can be going up and down and making it harder for you to deliver vaginally in the future.
Interesting. Yeah.
I know.
I guess I wouldn't personally recommend that for anybody because it just sounds awful. If it ain't broke, don't fix it. Just get a third one.
That's right.
But yeah, no, I feel like if mom really wants to try it, I'm all for it if she's healthy and able to.
All right, true or false? Question number 7. Twins that are the same gender are always considered identical. False. Very good. Question number 8. No cheese is safe to eat while pregnant.
False.
Totally false.
I love cheese and I ate a lot of it during my pregnancy. I just stayed away from the soft ones.
There you go. You need to eat pasteurized cheeses when pregnant. Stay away from the unpasteurized.
Mm-hmm. I love my hard cheeses.
Hard cheeses.
I love my hard.
Question number 9, true or false? Someone trying to get pregnant should start taking folic acid before they become pregnant.
True.
Very
Absolutely true.
Absolutely
yes,
true.
I had some difficulty getting pregnant with both of my children. And so I was hopped up on prenatal vitamins
There you go.
long before like when we were trying.
And folic acid,
and
right?
Yeah, it was the extra folic acid.
Oh, yeah. There we go.
Mm-hmm.
Perfect. Last question, true or false? Question number 10. Baby aspirin is an over-the-counter medication that can help prevent a certain type of blood pressure issue during pregnancy.
I feel like I wouldn't take anything over the counter when I was pregnant with a blood pressure issue. So I want to say false.
It's true.
Is it?
Yes.
You can self-treat for like...
No, it's not treating. It's prevention.
Really?
Yes. A baby aspirin, 81 milligrams, a little tiny little.
Wow.
Yeah. So like if you have risk factors for
Okay.
preeclampsia.
So if you're not yet preeclamptic.
Correct.
Okay. So if you think you're at risk and you want to prevent it, you can take the baby out. Is it daily?
Daily. And you can actually go online. Preeclampsia.org has a big site talking about how to screen yourself. So you can just look at their little
So
check
with that
boxes.
milligram, like, so how long do the whole pregnancy they take the one a day? And does that affect their their blood thing at all during delivery? Because I know so one of the things Rob and I were talking about, we've listened to a lot of Dateline when we drive long distances. And on one of the episodes, they were talking about the serial killer, and he had one victim who survived, and she was pregnant.
Oh,
she was very pregnant. She was stabbed something like 27 times. And Rob was like, how did she lose that much blood and survive? And I said, well, your blood volume increases when you're pregnant. And especially when you're like in the 3rd trimester, you are just pulsing with extra blood. And that in my mind, I'm like, that's probably what saved her. The fact that she didn't bleed out to death.
And in pregnancy,
baby
you're
didn't
also
survive, but
hypercoagulated, right? Because you're preparing to lose a lot of blood. So your blood is a little bit, for lack of a better term, thicker because you're preparing to clot when you bleed.
So the baby aspirin just makes you more normal more than anything else. It wouldn't cause you to bleed out because your blood's
your blood wouldn't be, you're more likely to become anemic.
Yes.
But that doesn't mean your blood is thinner because of just having a dilutional anemia. Kind of getting a little bit sticky here. But because your body's getting prepared to clot quicker, it makes you more prone to getting blood clots in your legs. But if someone has an injury, their blood should coagulate better than if they weren't pregnant.
See, and now things are clicking because I'm thinking to like women in their 3rd trimester, and if they're traveling and driving long distances or on airplanes when they shouldn't be, the one big thing that we worry about is blood clots in their legs. So,
True.
My gosh,
that's right.
Those DVTs.
That's right. So the aspirin, if they're a candidate, they should start it right around 12 to 16 weeks. So at the end of that 1st trimester, once a day, every day with food so that it doesn't cause them nausea. And then you take it all the way up until a day or 2 before you deliver.
And it doesn't affect the baby at all.
No, it doesn't decrease the platelets of the baby. It doesn't cause you a higher risk of hemorrhage. You're not supposed to take it if you have liver disease or kidney disease or an ulcer that you know about that's a bleeding gastrointestinal ulcer. Or if you have a reaction to aspirin, right? Or you have a platelet disorder or some kind of weird bleeding disorder.
But if anything else checks out, like that's great.
Yeah. And it's very easy, cheap, over the counter. And
I had a couple really healthy friends this year have preeclampsia, and it was not pretty.
Correct. It's not pretty. And, we've seen a lot in the news from people that are celebrities or athletes even that have gotten preeclampsia, that have died from complications associated with preeclampsia. And it's more common in Black women.
Wow.
And they're being underserved across the U.S. And it is terrible to watch. But just being Black is a risk factor and a reason enough to take aspirin.
Wow.
Whether it's first baby, whether your, weight is high or low, whether you have twins or not, that in and of itself. Twins in and of itself is actually another indication to take an aspirin.
Yeah.
Yeah. Lots of complications with those.
Yes.
Yeah. Okay. So let's get into, I know you kind of know what I do here with this, but expanding our knowledge on anything we want to talk about today. And we know what you do, which is awesome and fascinating. We know you've had 2 kids. What, I guess, would you say if you were to talk to someone who either doesn't have kids or is going to have kids again, about how can they learn more about advocating for themselves in a pregnancy?
Oh, man. It's one of those things that's so hard to explain to someone until they're in it. And so I always have this like list of like do's and don'ts and things to look for. And like, obviously like in our line of profession, the biggest thing for us is like word of mouth.
Mm-hmm.
So we're always asking each other, like, who's the best doctor to deliver you? Like, who do you want to be on call? Like, and it's partially joking, but it's also good information.
Mm-hmm.
So it's walking that fine line of like asking someone a question and then getting like too much information where it's like almost invasive. And then but getting the right information that's going to help you through your delivery in a good, calm fashion. And and the problem is like, it's like Greek when you're explaining it to someone who's never been through it. So obviously the best method to be able to advocate for yourself when you get pregnant and go into labor and go to the hospital is to have already had a kid. Then you kind of know everything that went wrong in the first delivery or things that you wish you would have asked for or things you wish you would have done.
Yeah.
And then you go into your second delivery and you make a whole second set of mistakes. So really by the time you have your third kid, I would assume that you'd have everything down, right?
Yeah.
I did not get to that level. But I guess,
but do you think that when you were pregnant with your first, if you had something, because that was before there wasn't really like, I mean, there was the internet, but it wasn't like this. Like
I wish I had a pregnancy coach. I won't lie. So I'm going to plug your business here. I wish I had a pregnancy coach. It's like kind of having like a concierge OB-GYN at your beck and call, within reason, to like calm your fears and ask the stupid questions and like, and not be caught in like a birthing class situation where you have 16 other couples staring at you while you ask the dumb questions. Having a consummate professional be able to tell you like what you should be looking for. Obviously, I read all the reviews before I go find any professional. So that's
a very good point.
I used to work, when I was a prosecutor, I used to work for a lot of the state licensing boards. So one of the great things that the state licensing boards do is if your doctor has been disciplined, it's on their website and it is free to the public.
That's a very good point.
Yes,
I think we forget. What is the site or where would they Google to find that? Or
oh man, it is. I think. Oh gosh, they changed the name on me to something more PC.
We'll look it up and we'll put it on the down below too.
It used to be called BOMEX back in the day. BOMEX, Board of Medical Education Examiner, medical examiners, something. It's Arizona Medical Board. azmd.gov. And so every profession that's licensed has a board. So there's a dental board, there's a nursing board, there's a podiatry board, there's a medical board. And if your doctor is licensed in the state, they are overseen by the board. The great thing that the board does is there's 2 ways to look up whether your doctor or not, your doctor's like naughty. So
you can look it up on a state level and federal, or it's
just a state level.
State.
It's every state's different. They actually share a database, but that database is not available to the public. It's only state to state. So we can catch providers that are state hopping.
I see.
Yeah. So to prevent state hopping, there's now a national practitioner database, NPDB. And so the state's
DB.
Yeah. National Practitioner Database.
Okay.
So if you're a medical practitioner of any kind, even respiratory therapists, I think go into the NPDB if they are disciplined. So now you have to realize there are different levels of discipline. So the lowest level of non-discipline is called like a letter of censure or a letter of non-disciplinary conduct.
Yeah.
So those do not get published.
Huh.
If your doctor has one on site, it may or may not mention it, but you can always call the board to ask them if you can have a copy. They may or may not release it. I don't know. But if it's above the non-disciplinary level and goes into discipline, so that's where we get like a decree of censure. It's where your probation kicks in. It's where your suspensions kick in. Those are all published on the website. And I think they're like up there for quite a while. They're like up there in perpetuity. So
this is good to know because I feel like most people, when they're looking at a physician, they will look at
the health grades, social media,
and
Yelp.
I'll ask friends. But then also it's nice to have some objectivity, right?
Yes.
To just know what's happened in the past. Is there anything ongoing?
So
and
for
data?
doctors to hit discipline level, like it has to be pretty egregious. I've seen a lot of doctors slide through the non-disciplinary door or through the probationary door, through like the substance abuse, like going through counseling and doing the in-house program type stuff. But for the most part, like if they have something on file, it's probably worth a read. It may not be the be all end all. And the other thing you can do is you can always search their minutes. So most of the boards do publish their minutes. So if you're kind of curious as to the discussion around like why this person may have been disciplined, one of the things you can do with some of the boards is you can go find the date of discipline, go find the meeting agenda for that meeting where they disciplined him, and then ask and get the meeting minutes and actually listen. And sometimes they record it. Sometimes they have a video. It's been a while since I've been at the AG's office, but things may have changed. But you can always get the minutes because legally they're required to have minutes. Sometimes the minutes are bare bones, but a lot of the boards, especially during COVID, I think went to recording the full sessions. And that's been great because you can watch the whole thing. But yeah, it's important to be informed about who you're going in to meet, and then talking to your friends and family and getting those recommendations, those firsthand experience. Like she was great at this, he was great at that. And then like, I guess I advocate for reading, but there's a caveat to reading things on your own.
Like what's the source, right?
Yeah. So like, everybody I think reads What to Expect When You're Expecting. I think that's like the Bible of birthing. And for like the ABCs, it's great. But man, there are things they don't tell you in there, right? Which is why I'm so glad this podcast exists. There are so many things we don't talk about. Like, I think when I walked in here, we were talking about having that glass of wine in your third trimester to loosen things up.
That was the thing that people would do back in the day.
That was a prescription I received from my doctor. Go take a warm bath and have yourself a glass of red wine because I was overdue. These days,
the thought that the red wine would put you into labor?
It would relax me and put me into labor, I believe is what he thought. I think there's also like other properties in red wine and like kind of helps oxygenate you. I don't know.
You know what though? And we didn't bring this up much too, but I did talk to a couple of OB-GYNs that practiced in the period before I practiced, where they used to use ethanol diluted in an IV to slow down or stop preterm labor, to relax the patient, quote unquote. That was a thing.
It's amazing what are things. And like I said, in the last 11 years, things have changed. Like it's insane.
Yeah.
But yeah, and these days, I don't think we tell women to take a nice long warm bath in their third trimester in case they're ruptured, because that's a very good way to end up with an infection. We get a nice case of choreo walking in the door.
And temperatures, it's hard to, I don't know how many people have a thermometer at home where they can check their bath water. But if you get the bath water too hot, you really don't want to take a hot bath, and you don't want to be in a jacuzzi during pregnancy.
Exactly.
So a warm bath is a little confusing.
Yes.
It would be for me because I wouldn't have the temperature.
Exactly. So, I got a lot of instructions during my first pregnancy that probably would not fly these days.
Interesting. Okay. So I want to kind of shift over a little bit because you are, in my mind's eye, a really big foodie.
I am.
And I did a podcast with Christopher, and Christopher as well, Chef Christopher. And he remembered that we met at my birthday. And it was you that took me there for my birthday. And you've since grown what I think too is an insanely awesome social media following for your food, because you take these amazing pictures. I think you're also, I know you might not be, it's not a title for you, but I think you're a photographer because your photographs are insane.
I consider myself an amateur.
Yeah. Jack of all trades here, seriously. But in doing that and with food and stuff, did you ever find when you were pregnant, other than we talked about the cheese a little bit, that you found it hard to go to restaurants, or that people would give you pushback, or that it was like, I want my steak cooked this way, and they were like, that's not how we do it? Did you ever find that was like a weird thing? Because you eat and explore new places.
I do. And I eat a lot of things that pregnant women should not eat, or at least were not supposed to eat 30 years ago. But At that time when I was pregnant with Adia, not as much. I knew you shouldn't have frozen yogurt out of the soft serve machine because of the bacteria. I was told I shouldn't eat the soft cheeses. I was told not to eat the raw fish. There was like things I was told not to do. I lived in San Clemente in California. It's like home of some of the best seafood on the planet. And did I listen to all of the advice? No, probably not. I probably did eat a lot of frozen yogurt and have my soft cheese and eat my sushi. With the second one, I think I was probably a little bit more cautious, but also I was a lot more sick. I was pretty much sick around the clock, like just hyperemesis all over the place.
Oh,
so yeah. So I didn't have a lot of issues with the dining out because I barely ate during the first two trimesters. But I think,
do you think there's a shift then? So like, think about when you were pregnant, and even if you had friends that were pregnant versus like, if you go out now in 2023 with a pregnant friend, do you feel like it's night and day different? And like,
I feel like they're not concerned these days. I know that sounds weird.
No,
but I feel like I've gone out with some of my pregnant friends in the last year or two, and I feel like they are not as concerned about like the risks of eating things like raw fish and soft serve ice cream and yogurt. And I don't know why that is.
What about the alcohol? Do you feel like there's more of a...
They definitely don't drink.
Okay.
That has, I think, sunken in since our parents' generation. Because my mom was probably boozing pretty hard the night I was born.
So we were born in, I said, do you mind if I say when you were born? Because we were born the same year. So we were born in 1980. And I had mentioned when I had talked with Christopher about things too, that the data about alcohol and pregnancy was starting to come out in the 70s. Yes. And then the first advisory was released in 1981 from the Surgeon General. 1981.
So I was born on January 1st of 1980. And rumor has it that my parents were partying and that they did not want to leave the party before midnight. Therefore, my mother apparently went to the hospital in full labor after midnight. And they couldn't find a doctor because everybody was pouring champagne in the hospital.
Oh my gosh.
Yes. Yeah. So
welcome to 1980.
I know. So it was totally wild. And I'm like, oh, my doctor was drinking too. This is great. So yeah, it was a very different time period. Both my parents smoked. They didn't quit until maybe my dad didn't quit till 12 years later when my sister was born. So it's a lot of things have changed. And I feel like now, 40 some odd years later, the information about alcohol is there. The evidence is there. Like people are not ignoring that. I think our next new frontier is marijuana. Is really going to be, the next 40 years is going to be studying the effects of marijuana on the embryo, the fetus, and every stage and mom.
And then, just like you bring up with anything that's a substance, whether it's alcohol or types of drugs from the small thought to be or the large, is when you're trying to study the effects of it, it is hard because patients have different amounts that they take, particularly with alcohol, like reporting it. And then even with drugs, but also when you're looking at children as they go from being a neonate to an infant and then a child and then a tween and then teenager and those kinds of things, as they're growing up, there's so many things affecting them.
Yes.
How do we
separate out
with data at all?
What was the substance and what is like societal and
environmental
and genetic? Yes.
Yeah. There's so many things. And I think that's why the data is lagging, even though we keep
and ethically, it's not like we can get a bunch of moms high and track them for the next 20 years on how their children do. Like ethically, we can't do that. Or should we?
Right.
But it's all pretty much like anecdotal data. It's all observational data. And then here comes the other part is like the stigma of certain drugs and substances. So like finding people to report the data in an accurate manner.
True.
Like, is a mom really going to want to admit that she was smoking like an ounce of weed a day?
Yeah. And and I know this is more of a general question, but as someone that knows the law better than probably a layperson like I do, when you look at kind of someone who's pregnant, they can still buy cigarettes. They can still buy a drink.
Absolutely.
No one can refuse that to them. Nope. Is that something, this is more just speculation, just from your brain, Like, is that something that you feel could end up being a state by state law down the road or a federal law? Or like, you think it just probably won't change? I'm just curious your
As far as
opinion.
substances or
Yeah,
as far as the
the
cigarettes and alcohol and
the law and being able to serve it to people that you visibly know or who tell you they're pregnant.
I think government intervention is a fine line. And when you open that door to ask the government to intervene, it's very hard to ask them to shut that door or even slightly shut that door. So in inviting the government to create a set of laws or a federal law to police that, I think we get into a really sticky area, which is probably why it hasn't been done yet. I also believe that big tobacco and big alcohol probably had a lot of very well-paid lobbyists have their hand in the fact that we haven't completely outlawed the servicing of that to pregnant people. Also, then it comes the question of how do you tell they're pregnant? Sometimes women are just kind of belly heavy. Sometimes it's a burrito belly and not a baby belly. So I think people are kind of scared to broach into that arena to regulate it because there's too many unanswered questions.
Yeah.
What are you going to make them pee on a stick?
Yeah.
Every time they walk into the bar? Yeah. How do you enforce it? So one, do you want to enforce it? What's the public policy good? And then does that outweigh the invasiveness to your privacy rights? And then how would you enforce it? And I don't know if the invasion to your privacy rights and enforcement would be able to measure up to the public good that it might do to outlaw something like that. So I think at the end of the day, we have to look at somebody who was adult enough to get pregnant and carry a child and hope that they can make the right decisions.
Yeah.
Or at least enough people around them will look at them in disgust and get them to stop. So really, if you have these issues, please, please, please be upfront with your doctor because they're here to help. They're not here to report you to CPS and get your baby taken away. They are here to help. So I think one of the funniest things when I first started working in the hospital is you just got to trust that your patients are lying to you.
Good way to say that.
And I would just be what?
Well, do you remember the shampoo thing that happened? I think that was nationally, but there was a certain type of shampoo they were using on the babies in the NICU or in the nursery area. And babies were showing up positive for marijuana and mothers were saying it was something with the shampoo that was making false positives. And so they were getting I believe they were getting CPS involved. And then they were like, wow, this is a lot of marijuana all of a sudden out of nowhere. So,
and I think the only time we ever called CPS is if you delivered and popped positive on the screen. And then there would have to be a reason why we ordered the screen. So, because I don't think we did those standard on everyone. I think we did them on moms that had no prenatal care, moms that have a history, things like that. But that's usually the only way CPS would even get involved is if your baby came out high.
And bringing up marijuana too, the thing I think that people always want to know is, what are you going to see on my ultrasound that shows you my child or future child, current fetus is affected by insert marijuana, a medication, whatever. And oftentimes I have to really explain, even if an ultrasound looks quote unquote normal, structurally, I cannot tell you how that child will walk, roll over, language skills, neurologic development. I can't do that with an ultrasound. And that's something I think as providers, we have to get better at in having that conversation with a patient and saying, yes, your ultrasound is quote unquote normal.
Fine,
that means the structures have formed. That does not tell me about the IQ of this child at the age of 5, 10, 20, et cetera.
And a lot of those moms aren't thinking about that far ahead. They aren't. And then they don't really think about it until your kid's not hitting the milestones and you're wondering why. Why is my kid not reading yet? Why is my kid not walking yet? So it'll be interesting to see what the data uncovers in the next 10 years.
I know. You definitely need it. And that's the other thing too, is we are fighting from a legal standpoint within the medical world to try to allow pregnant women to enter studies if they give their own consent. Just to be able to get more data on things. And some of it is retrospective, meaning they're not going to be exposed to something. They're already on the medicine. They just want to be able to tell you what happens because they've chosen to be on this medication, like for seizure disorder, anxiety, depression, hypertension, whatever it may be.
I think the personhood argument is a whole nother podcast But yes, I've been able to see how it's been affecting women and their pregnancies just across the board. It's not really yours anymore.
Yeah, it's frustrating.
It is.
And I was going to bring this up, and I can take it out later. I'm going to bring it up anyway. We can delete it if we want. When we're talking about not being able when we're talking about being able to, or having to rather, still serve someone alcohol or tobacco when someone's pregnant, that there's no law against that. Do you find it interesting that there are laws against things like abortion whenever, if the government doesn't have a finger in the pie of being able to, alcohol and drugs, a fetus that's already there and possibly increasing risk.
This is going.
Fetus. Do you see what I mean?
Yeah, this is going to the personhood argument, because if we are granting all fetuses personhood, they are entitled to lots of rights. They would be entitled possibly to ride in the carpool lane while they're still in utero. A murderer who kills a pregnant woman would definitely in any state get charged with 2 murders, which is not true in every state. I think in some states it's state by state, and I think in some states, if your fetus is not viable outside the womb, it may not count as a double homicide.
Interesting.
Yeah.
So it depends on how far along pregnant the person
used to be.
Some states,
Again, I have not been in law school in a long time either. But back when I was studying, there's the discrepancies between state and federal law, and where states go state by state, they can make those determinations on their own. So if you have a particularly conservative state that believes that that life begins at conception and they have attached personhood, let's say to 10 weeks, 8 weeks, we're seeing in some states right now. In those states, you would expect that it would be a double homicide. In the states where they don't recognize the personhood outside of surviving outside the womb, they may not. But then, who doesn't want a murderer to go away for a double homicide for killing a pregnant woman, right? Like, who doesn't want that? But on the other side of that, does every shop owner want to go to prison for serving alcohol to a pregnant woman because now they have served alcohol to a minor?
Wow. There's so many layers to this, number one. And number two, this goes to show how it's ever changing. And it's not, I think too, because my field is medicine and yours is law, we always have the ability to have interesting conversations about the ever changing arena of what we do. And you got to stay up to date on it. And if I was someone going to seek assistance from an attorney, I would have a lot of questions, right? And same if someone's coming to see me as a physician. And I think that all we can do is try to arm ourselves with the most knowledge we can to ask the right questions. We're not going to be able to answer all the questions. And also understanding the person we're asking the questions to, they might need to look up some stuff and catch up on the new rules, regulations, because they are so frequently ever changing.
And if I'm not practicing in that area, guess what? I don't know anything about it till I start looking stuff up again. So,
and every state is so different. So if you are pregnant, I always encourage you, know the laws at least the best you can in your state. There's tons of websites that you can go on. The American College of Obstetricians and Gynecologists, that's what we call ACOG. And then the Society for Maternal-Fetal Medicine, smfm.org. They have links for state advocacy and information just so that you can educate yourself. And then not only depending on what state you're in, then look then at what practice you're in. Because if you're in a small town versus a very large city, it might be different as to, can you deliver in your small town? Oh, you have to be past 36 weeks or 34 weeks or whatever, versus, oh, they'll deliver me at any time, independent upon, how far along I am. So many rules at the state level and at the hospital levels, right?
No, it's the medical and law so intertwined. We actually have a JD-MD program at the university I work at. So you can concurrently get both your degrees.
I did not know that.
Yeah.
So then what do they do when they're finished? They have to decide, I'm going to go be a lawyer, I'm going to be a doctor.
Yeah, they can decide, but they'll essentially be licensed to do both is the goal. So they do, I think they do a few years of their medical program. They come and do 2 years of law school. And then they do one last year of medical, and then they go take their bar exam.
Okay.
So it's crazy. It's an insane program. I love all my JDMD students. They are so smart. They are so motivated. I don't know. I thought law school itself was hard. So throw medical school in there. That's crazy.
No, thank you.
Yeah, but it's absolutely wonderful because that intersection is they're so intermingled. And, when I graduated law school, I did my paper on the definition of death and the call for a uniform definition. Because that was back when Terry Schiavo was
I
happening.
remember
Yes.
that. Yeah.
So one of the big things, and then there was a little girl who had gone comatose after like a tonsillectomy, I think.
Oh.
And her parents had her moved from one state to another, where in the other state, they wouldn't declare her dead. They wouldn't declare her legally dead in the other state.
Wow.
So they moved her to continue her care and keep her on a ventilator and keep her alive. Because in the home state they were in, they had declared her legally dead because she was brain dead. And within their state laws, that is the definition of their death. They didn't have that in the next state over.
So even the definition of death
itself,
is state
by state. Yes. Some states need like 2 doctors to declare it. Some states need like a brain test. It was insane. There's just so many different standards. And so, my entire paper was exploring like what would happen if we had a uniform definition.
Mm-hmm.
And that way, families like this weren't doctor shopping essentially.
Sure.
But yeah, it's definitely an unfinished paper. There were so many other routes I could have gone down, but it's the state to state, even county to county, city to city. Everybody's a little bit different.
Well, and now that you bring that up, I have to just finish with kind of this little story too. My father, you've met him before. You guys should probably know that my father was a chemistry teacher, high school chemistry teacher, and then went on to be an assistant principal and then a principal. And he then, when he retired, ran for justice of the peace. And justice of the peace in certain small towns in Texas actually serve as almost like the medical examiner, because if their county is small enough, they don't have medical examiners. So my wonderful father, who was trained as a high school chemistry teacher, is now
Papa Rick
declaring people dead, pronouncing their deaths rather. Yes. So like when deaths occur, he has to do that and assist with deciphering whether an autopsy is necessary or not. And there's so many hats that he wears with this. It fascinates me that in the US, then break down state by state, there are some states that still have people elected positions that are doing, I'm not going to call it medical work, but they're in this medical space.
It is. He's essentially diagnosing death. And
first
time I talked to I talked to him about it, it was like wild to me. I said, "Whoa!" I said, "What kind of training do they put you through for that? Like that's really crazy."
You did get a cowboy hat. I mean, It's Wild Wild West,
But yeah, it's the definitions drive everything in the legal world,
sure,
and in the medical too, to a degree. And it's just it was completely nuts to me when he was telling me about some of his job duties when he first got appointed.
And he's on call. Like he's got I think it used to be a pager and now it's your phone, but I mean, he's on call.
He's on call. And I was like, this is wild.
He's like a lawyer doctor, but a chemistry teacher, lawyer doctor.
And I guess in his cases, clearly the person has died. If there were emergency workers there, they have finished whatever they're doing. And I think the definition of death gets really entangled where it's like a brain death, but not a physical death. But yeah, I think it's completely wild that your dad gets to sit there and be like, well, that kind of might be a homicide. Let's have an autopsy.
Let's look into that one.
I'm so nervous about making those calls. Like this one looks a little fishy.
I know, right?
Let's cut that one open.
Yeah.
But it's absolutely amazing. The work that he does and the experience he's gotten over the years at this job.
Yeah.
But yeah, and especially in light of what I wrote about.
I love that you shared that about that paper. Is this paper been published?
Oh gosh, no. It is not a publishable paper. It was
I still want to read it.
Oh Lord, no. It's garbage. It was my graduation writing requirement. So I would just it was me, a bottle of tequila, and about 25 pages. So
pretty good for the tequila.
But yeah, it's I might let you take a peek at it if I can ever find it again.
Okay,
but,
go looking for it.
It was not my greatest work. I went down a rabbit hole and it was a deep one. And by the time I came out of that hole, I was like, I don't know what I was writing about towards the last couple chapters there.
Now I really want to read it. Well, I think we've done a good job kind of hit on quite a few little topics here today. And the big thing, expanding knowledge, which we've done on various topics, developing skills, looking at questions that we can ask, ways to really advocate for ourselves. Ask the questions if you don't know the answers or if you're just curious
don't
about
be afraid to
something.
ask.
Find out about your doctors by asking around, and go on websites if you need to get more information. Always advocate for yourself to have the provider that's right for you. And then the whole point of all of this is to have an impact. to have a positive effect on those that are watching, for those that are pregnant or wanting to become pregnant, and so that they can have a happy and healthy pregnancy. The whole point. So, as always, don't forget to head over to the YouTube / at drlexihill.com. And I have to say thank you again, Frankie, for coming today.
Thanks for inviting me. And my mug.
Oh, yes. And the mug. I love the mug. Well, thank you all again for watching. I'm Dr. Lexi, wishing you a happy and healthy